Hi, I'm Jamie, your family nurse practitioner at Urgent Plus Care. One question that we receive pretty often around here is what tests are available for COVID-19, who should get tested, and what should you do if you receive positive test results? Let's turn to Dr. Keith Rigsby for advice on the subject.
Hello, Facebook family. This is Dr. Keith Rigsby. I'm an internal medicine physician in the Dallas-Fort Worth Metroplex. I'm here at Urgent Plus Care, Urgent Care Center. Today, I am here to discuss or answer a question regarding who should get COVID-19 testing, what type of testing is available, and what should you do if you get positive test results. So, in the beginning, I'm going to say that this is my recommendations based on my experience as a internal medicine physician working in hospitals, nursing homes, my own primary care clinic, and this urgent care clinic. Regarding who should get tested, well, it depends on the test. The two types of tests that are available. One is designed to evaluate if you're sick with the virus right now and you're spreading the virus. A second type of test is designed to see if you have ever been infected with this virus before. It is an antibody test. So the first test is called a PCR test, and the second test is an antibody test. When you say, well, who should get what test and when? So if you want to know if you are currently infected and if you've ever had the virus before, then you get both tests. And then you would know at that moment in time if you had the virus right now or if you ever had it in the past. Okay, so in general, I would say that everyone needs to get tested at some point because all the measures that we're taking with masks and social distancing, which you should do, is not designed to keep everyone from getting the virus. The purpose of all of what we're doing is to prevent how many people get sick with the virus so quickly. We want to stop how many people get infected at one time because it would overload the healthcare system. Most infections are transmitted from family members because family takes care of family. It's usually children to parent or parent to spouse. Now, regarding what should you do if you get a positive test result? Well, if you get a positive test result and it's with the PCR test, the test that shows that you actively have the infection, then you should go quarantine yourself. You should stay away from most people and always wear a mask when you're around someone. That's the most effective way of preventing the transmission of the infection. Now, you'll hear many of the media say go home and quarantine. But what I would tell people to do to make sure that things didn't get worse is to monitor yourself at home. Call your primary care provider, let them know that you're sick and that you're quarantining. And if you ever get up to go use the restroom or to move around and you can barely get to where you're going because you're so short of breath, you should come to the emergency room and get evaluated because your infection could be one of the small percentage of patients that are getting really worse and not just need to come to the hospital, have to come to the hospital to get past this infection. One note I would say is that today I actually discharged my first patient that was COVID-19 positive. She was 21 years old and had to go into the hospital for a week to get past the infection. So this virus does not matter. It doesn't care your age or your health history or anything else because it's going to affect everyone. And it's expected that 1 out of 2 people worldwide will have it in a year. Regarding if someone wasn't currently sick right now and you just want to know if you've ever had the infection in the past, well, then you can do the second test, the antibody test, which is a pinprick test. That test can be performed within and get results in about 20 minutes. And the first test takes a little bit longer, about an hour. We do both of these tests at Urgent Plus Care because our goal is to provide the community with the healthcare it needs when the healthcare is needed. I want to thank you very much for your question. I know that it was brave for you to do that, and many people had that question. I want you to please feel free to leave any other questions, healthcare related or questions, in the comment section. Please remember to like this and share this with all of your friends and family. And remember that Urgent Plus Care in Ennis, Texas is here for you to provide the care for you during this COVID-19 crisis.